Have you ever thought that your heart, that small muscle inside your chest, could suddenly betray you in just a few short minutes? Hard to believe, yet each year, nearly 7 million people around the world die from heart attacks. Have you ever wondered why a disease that seems so distant has become the #1 killer globally? Picture this. On a peaceful morning, you're sitting with your grandchild, sipping tea, when suddenly it feels like an invisible hand is squeezing your chest. You gasp for breath, cold sweat drips down, and your grandchild's worried eyes fix on you. Could that moment be your heart's final warning? Heart attacks don't care who you are, rich or poor, seemingly healthy or never sick. They strike suddenly, like a thief in the night, stealing millions of lives, especially among those over 60. Do you ever fear that one day you could become the next victim? In this video, I'll explain why the heart rebels, what warning signs can signal an oncoming crisis, and the simple steps you can take to keep living joyfully with your family. But before we dive in, let me ask you, would you rather live 10 more healthy years or sit waiting for your heart to toll its final bell? If you choose health, hit subscribe now and type the number 1 in the comments. So, what exactly is silently poisoning the hearts of millions? Let's step into the next part to uncover this hidden truth. Many people still believe heart attacks only happen to those who are overweight, smokers, or work themselves to exhaustion. But did you know, even retirees living what seems like a calm, easy life can suddenly collapse simply because their heart no longer receives enough oxygen to function? Have you ever wondered why this disease is especially dangerous for people over 60, even when they don't feel weak or sick? The heart, like every other muscle, needs a constant supply of oxygen-rich blood. Yet as the years pass, fatty plaques silently build up inside the artery walls. Imagine your arteries as pipelines fueling your heart. One day the plaque thickens, roughens, and even cracks. And in just minutes, a blood clot can completely block the flow, leaving your heart suffocating. Can you believe that death can come in that very instant? Older adults are more vulnerable because of weakened immunity, less flexible blood vessels, and the heavy burden of dangerous companions like high blood pressure, diabetes, or high cholesterol. Can you imagine the terror of a heart attack striking while you're alone in a quiet house, unable to call for help, unable to say one last word to your family? That is the deepest fear of millions of people after 60, not having enough time. And yet, what's even more dangerous is that some heart attacks happen completely silently. No crushing chest pain, no dramatic collapse like you see in movies, just fatigue, a little shortness of breath, or sometimes no symptoms at all. Can you be certain you would recognize the SOS signals your heart might be sending? So, how can you detect a heart attack early, before it's too late? In the next part, I'll show you the obvious signs, as well as the surprising ones that older adults often overlook. Are you sure you already know them all?
Symptoms of a heart attack. How can you tell when your heart is crying out for help? The most common symptom is chest pain. But don't assume that all pain feels the same. Many patients describe it as a heavy stone pressing down on their chest, or an invisible hand squeezing their heart tight. Have you ever felt your chest clench, struggled to breathe until you had to stop and rest, and asked yourself, is this just tiredness or a warning of something far worse? That pain doesn't always stay in the chest. It can spread to the left arm, up to the neck and jaw, or even down to the back and stomach. You may feel nauseated, dizzy, or break into a cold sweat. What makes it so confusing is that these symptoms can easily be mistaken for indigestion or the flu. Are you certain that your last stomachache or nausea wasn't actually your heart trying to warn you? For women and older adults, things can be even trickier. They may not feel severe chest pain at all. Instead, they may simply feel fatigued, weak, or slightly short of breath while walking. Have you ever blamed such symptoms on just getting old without realizing it might be your heart's final warning? It's especially dangerous for people with diabetes. Because their nerves are damaged, they may experience a heart attack without feeling any pain at all. This is called a silent heart attack. Can you imagine the horror of your heart shutting down without you even knowing it? So if one day you or a loved one show these signs, what must you do immediately to save a life? In the next part, I'll share the urgent steps you need to take when you suspect a heart attack, and how even a few minutes delay can mark the boundary between life and death. Would you like to learn those simple yet life-saving actions?
Emergency response when a heart attack is suspected. When someone shows signs of a heart attack, the most important thing is not to panic, but to act quickly. Did you know that with every passing minute, millions of heart cells are dying from lack of oxygen? And if treatment is delayed by just 30 minutes, the damage to the heart can become irreversible? The very first step is to call emergency services immediately. Why shouldn't you drive the patient to the hospital yourself? Because during those few minutes on the road, their heartbeat could suddenly stop, and only trained paramedics have the equipment to resuscitate in time. Can you imagine being behind the wheel when your loved one suddenly stops breathing and you don't know what to do? While waiting for the ambulance, there are two simple actions that can save a life. First, give the patient a low-dose aspirin to chew, since aspirin helps thin the blood and prevents the clot from growing larger. Second, if they already have nitroglycerin prescribed by a doctor, place one tablet under the tongue to dilate the blood vessels and improve blood flow. Isn't it incredible that such a tiny pill can sometimes become a ticket back to life? Equally important, keep the patient calm. Have them sit still or lie down in a comfortable position. Did you know that panic and exertion only force the heart to work harder, making the attack more dangerous? So what will you do to comfort your loved one in that moment, even as your own hands tremble with fear? But even if you've done everything right at home, the decisive battle is fought in the hospital. That's where modern medicine can reopen blocked arteries and rescue the heart. Would you like to know exactly what happens when a patient arrives at the emergency room with a heart attack?
Hospital treatment for a heart attack. Once the patient reaches the emergency room, the race against death officially begins. Doctors will immediately perform an electrocardiogram, ECG, a recording of the heart's electrical activity, to detect where the signal has been cut off by a blockage. Did you know that just a few jagged lines on paper can reveal exactly where the heart is crying out for help? At the same time, blood tests are taken. Certain cardiac enzymes rise sharply when heart cells begin to die. Have you ever thought that just a small vial of blood can reveal the extent of injury inside your heart? After pinpointing the blockage, patients are often taken straight to the cardiac catheterization lab. Here, doctors insert a tiny tube into the blood vessel, inflate a miniature balloon to push the plaque aside, and restore blood flow. This procedure is called angioplasty. Usually, a small metal or polymer mesh called a stent is then placed to keep the artery open. Isn't it remarkable that such a delicate wire mesh can save an entire heart on the brink of failure? In more severe cases, when multiple arteries are blocked, doctors may need to perform coronary artery bypass surgery. They take a vein or artery from another part of the body and create a new pathway for blood to flow around the blockage. Can you imagine that your body can lend one of its own vessels to save the very heart that keeps you alive? Thanks to advances in medicine, survival rates after a heart attack are higher than ever. But ask yourself, do you want to depend on pills and machines for the rest of your life? Or do you want your heart to be strong?
Prevention of heart attack. Here's a truth many people forget. Prevention is always easier and more effective than treatment. Do you really want to wait until you're lying in a hospital bed to start making changes? Or would you rather act now to keep your heart healthy? Research shows that with lifestyle changes alone, you can cut your risk of heart attack and stroke by up to 80%. That means the choice is in your hands. So have you ever asked yourself, what can I do in my own kitchen, with my own daily habits, to protect my heart? The answer is simpler than you might think. Regular exercise, even just brisk walking for 30 minutes a day, improves circulation and strengthens your heart. Are you willing to trade half an hour each day for many more years with your children and grandchildren? When it comes to nutrition, your heart will thank you for cutting down on sugar and saturated fats, the silent enemies that build up in your arteries. Eat more vegetables, whole grains, fish, and chicken instead of red meat. Even a handful of walnuts or almonds each day can serve as a natural shield for your heart. Do you ever wonder if your daily meals are nourishing your heart or slowly poisoning it? Adequate sleep, stress management, and a positive outlook are just as important. Do you realize that every smile, every moment of laughter with your grandchildren is itself priceless medicine for your heart? Of course, for those who have already had a heart attack or are at high risk, medications remain essential. Low-dose aspirin, blood pressure medicines, cholesterol control, and diabetes management are vital companions in preventing another attack. But the real question is, do you want to rely only on medicine, or do you want to combine it with a healthy lifestyle so that your heart becomes truly strong and enduring? The most important thing is to begin with small, simple actions you can take today. Walk a little more. Add an extra serving of vegetables. Go to bed an hour earlier. Each small step is like a brick, building a